Hey, everybody. Welcome to Meddkit's Provider Spotlight, where we are interviewing the really most amazing private practices from all over the country. We've interviewed people East Coast, West Coast, Midwest. You've got it down South. And we're getting perspectives and hearing the stories of all these really interesting providers and how they're helping their communities. And today we have an amazing guest, Dr. Tara Beran. So thankful you are here to be with us and
Thank you.
chat about, your experience and all the things that you're going to enlighten us with. So would love to hear kind of how you started. What is your origin story? What inspired you to open up your practice?
Well, it started, when I was a kid, I always wanted to be an OB/GYN, and that was what I was going to be for most of my life. And then started to change the end of college. And I decided I wanted to do something where I had more time to spend with patients. And I ended up changing into physical therapy. And I always laugh because I was there and I was like, I'm not sure I really like the shoulder that much. And I don't really like, the knees that much. I'm thinking, oh my gosh, did I do the wrong thing? I really should just go back to med school. And then one day there was a class and it was women's and men's health. And I sat there and I was like, this is it. This is what I really want to do. I was like, this is easy. I actually don't even have to study. It's like already in my brain. And I was so excited. And I knew that there was really no one out there doing that at the time, because it's been 19 years, which is a little scary to say. But yeah, but so then I was like, okay, I'm going to pursue this. And that's what I ended up doing. And then I ended up getting pelvic pain right before I started practicing for my, beginning of my career. And I was like, oh no, this is really bad. So I became a patient as well as the clinician. And I honestly think it was really rough, but it helped me so much understanding what patients were going through. So I actually ended up becoming so compassionate, empathetic, because I would go through this and patients say, how do you even know how to describe it? And I was like, well, I've been there. I've been on the other side. And so this is why it just became much more of a passion for me to do this. So then you asked the other question about starting my own business, and I decided I wanted a place that was really calming, that was really like you just went in and you had some sort of pelvic issue. You weren't going to an orthopedic physical therapy clinic and they're like, oh, shuttled into the back room, right? Because everyone's like, oh, they're going to the back room. And I noticed people weren't comfortable with that. So after a year of being a PT, I ended up opening up a practice. And I wanted to be more spa-like, more calming. People who came in, they all knew they were coming in for something going on with the pelvis. So it was sort of like this little community, right? You weren't embarrassed going in because everyone was going in for similar things. So that's what we did. Yeah, and it was awesome. It's been awesome.
I love that. And I love how you had created, not only your business, but you kind of been there, done that. And so you
Yeah.
really understand from the patient side how terrible pain can be and what that actually feels like, and in what areas, and how you're saying, oh, it's kind of hard to describe, but this is kind of, and you're like, yep,
Yeah.
yep,
Got it.
take
Yeah.
it.
Right. Yeah.
It's so nice to connect to patients in that way, because so often people don't feel seen and heard, and I think
Yes.
that's a part of the healthcare piece that we're missing in America, is to feel seen and heard. And so I love that that's kind of what you're bringing to like your awesome community.
Yeah. And I do love it. I always hope my patients see that, just because I am so passionate of helping them. And I know that I was able to get out of that pain. And so that's like always my goal, to be, part of that coaching, helping them, being part of that team to help them become better and be able to get back to who they are, because they always say, I just don't feel like me anymore. And so that to me is like, I want you to be you, but even better once you're out of this pain or, dysfunction. Right. Yeah.
That's the best feeling, right? I think
Yeah.
that's
Right.
the satisfaction that comes out of what you're doing when you can see someone thrive and graduate, from whatever
Yeah.
they're dealing with. And you're like, oh, I did that. Like I helped them get on their way, and now they have the tools to succeed.
Yes. Yeah. It is pretty awesome feeling. So yes, very love it. Very much love it.
Speaking
Yeah.
of pain,
Yeah.
what do you think is probably the most common thing or things that people tend to come in with? You know, what, yeah, what's your,
Yeah. So with the pain thing, so I see in our practices men and women. So for women, we'll see with endometriosis, PCOS, scar tissue through the abdominal wall pain, pain with sexual activity, anything, vaginal pain, rectal pain, pain with bowel movements, tailbone pain. It's a lot of pain stuff, right? Yeah.
and it's like not, that's really not fun pain. That's like,
No, no, it's very different. As everyone says, it's so different than, I mean, we all can accept a little bit like neck pain or back pain. It's
right.
not good, right? But there's something different about that pelvic pain that just really changes people. And so for women, we see that. In men, we see like, testicular pain, penile pain, rectal pain, tailbone pain, things like that. And so that's devastating to them too, because that's such a big, obviously it's very painful and that area gets really sensitive, right? So, because there's so much going on in there, right? There's between bowel, right? Stability, sexual activity, right? Just keeping so it's a big area. It has lots of nerves. So more pain. Yeah.
Yeah, something that you had mentioned, which I think is really cool, is that I don't think, and maybe this is just my own opinion, but I don't think a lot of men think that they can get treatment in the way that you do it. And
Yes.
I think it's more clear cut for women, maybe not, but I think women maybe tend to think about it a little bit more.
Yeah.
I think men probably don't think that this is an option for them.
No, they don't. And it's becoming where women, it was always like pelvic PT. And now that's much more common. Men they're still kind of so many years behind. So they end up seeking a lot of looking online stuff because a lot of providers just don't know what to do with them yet. And so once they find us, they're like, I never knew this existed. And you're exactly in that pain spot. You're exactly right, decreasing that pain. That's amazing, right? And so it is pretty rewarding if they find us, that they are able to get treated. And so I always say, what are the things that made you find us? Because I want to make sure I get that well known, and so people are easier to find. Men look it up and it's like right there, right?
Yeah, that's amazing. Yeah, I just wanted to bring that up because I think,
That's right. You're right.
Men can be, I feel like, somewhat of an underserved population and maybe somewhat of their own doing. They're like, oh, I can muster through this, I can get through this.
Yes.
I don't know, things like that. But I think it's such a great resource to be able to say that and say, yeah, I can help you. And you may not know it yet, but I can.
Yeah, exactly. Yeah. So just say when I'm at parties or places I meet people, I always bring that up. I said, you may never want to see me, but I want you to know that this is a service, and maybe a friend might say something to you and they're always like, okay, good to know. But it's very helpful because it's just those little bits that I teach just when I'm out with friends or I'm meeting new people and we're all asking like what we do. So it is really nice because I'm like this, and they're all like, that's interesting. Wow, I didn't know. So it's kind of fun to educate people in sort of a fun, like learning way, right? Yeah.
That's awesome. I so love that. And I love how you talk about it, not only with your friends, but like people that you just meet too. I mean, I think them like, hey, we can help.
Yeah, exactly. I know, it's pretty funny. Yeah, I do love doing that because they're always like, ooh, what? Yeah.
Conversation piece. I mean, at least I think so. But
I agree with you.
Yeah. And so, you kind of touched on this, a little bit throughout the interview so far, but you are different, very different. But how would you say your approach is also different? And are there kind of like particular, services or modalities you think are the most popular that really do help your patients a lot?
Yeah, so I think why we're different is that we see a patient for a full hour, which in the medical field is unheard of, right? So I know. So that and with that we are cash based, but we see that patient one time a week. So we don't see him multiple times. So it's time efficient. And then, it's roughly, they can get reimbursed a lot of times, but with that hour, we have so much time to really get to know them, really get to know what's going on, kind of see what else is going on in their lives that might be contributing to their pain or different things, right? We do incontinence, prolapse, right? Pregnancy, postpartum. So we do all that. But we really get to know them. So it's becomes sort of like they become family. But I think that's the big thing is that we, get to know them really well. So we're able to really focus on them. And they always say, like, we always feel heard because they have that time to tell us everything, right? Yeah.
That is amazing. Like an hour is such
Yeah.
a good chunk of time. Like that is amazing that you are giving that to clients and that I'm sure really helps you get to really see what the issue is, kind of drill down
Yeah.
into it and not just read into the symptoms. It's like, okay, we're going to figure out the cause now. And
Yeah. 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 So it is really, it's wonderful. And then you asked about kind of like what we do. And I think our strong suit at our office is that we do so many different kind of manual techniques and treatments. We also do, the stretching and the exercises, but we do a lot of training on a lot of manual stuff because in that area, there's a lot of more tension stuff. So we do a lot of through the week, all the pelvic PTs and I, we get together and we start going over like cases or who's not getting better or who needs what other things that they could do. And so we go over different techniques and treatments. So I think that's where we have our strong stuff is a lot of our manual skills, but obviously exercising and some stretching, depending on what's needed, is really important too. Yeah.
I love that. I think that's
Yeah.
super, super smart. But I also love that like you and your team get together and figure out like, hey, something isn't working with a client. Let's come up with something else. Let's address this.
Yeah.
With the fact that you're constantly getting together, constantly just not only thinking about the patient while they're there to see you, but outside of that appointment, I think that's so awesome. It's going the extra mile, and I think that's terrific. One question that I really love to ask, and you already debunked one about men, but with Google and our great age of technology, it can be extremely helpful, but extremely hurtful, and misinformation and misguidance of your health. One day you're fine, the next day you have stage 4 cancer because Google said so.
Right. Yeah.
That being said, is there things that are common misconceptions for you? People coming in asking questions, and you're like, "Ooh, I really wish you didn't read that." Like not what. No.
Yeah. Well, I would agree, especially the stuff that's a lot of like different pain stuff where they come in, they say, do I have pudendal neuralgia? Do I have interstitial cystitis? These ones are pretty big. They're pretty involved. And when they read all of it, it's pretty devastating to the patient. So we kind of have to, bring them off the ledge in the sense because they are freaking out. And a lot of times, majority of the time, it's not those. And so we're able to kind of explain what it may be. And I think like the big one when you talk about like either social media and the internet, and one of the things is, so the good thing about the social media is it kind of brought pelvic PT on the map essentially, right? Because it kind of brought us like, especially for pregnancy and postpartum, like you need to see a pelvic PT that can help with so many different things during, right, being pregnant and postpartum. And so that was a wonderful thing. But then you had where it was, everyone was like, okay, everyone has to do Kegels, right? And this is what you have to do. And then there was issues with that because if people have a lot of tension and pain, it actually causes more issues. So then people saw that and realized, okay, that's not the thing. Now no one does Kegels and it's a bad thing. And what it is it's all dependent on that patient. So some people could do some Kegels do really well, and Kegels are a pelvic floor exercise, right? And strengthens around the muscles to help decrease urinary leakage or bowel leakage, right? So in some ways, some people do really well with that simple exercises. Some people need some more support, and some people don't need that at all and so I think social media kind of puts out like, you do this. Now it's like, no, don't do this. Now you do this. So it's a little hard, but I just think it's starting to cause some conversation about the pelvis. So there's some good things and then some misinformation, but ideally, hopefully a lot of people will say, even when they do that, is like, always see a pelvic PT. So even the people who are talking about it will always say, see a pelvic PT to make sure this is the right thing to do. So there's some good stuff happening with that now, is getting advice. Yeah.
I'm always so wary about, the things that you read and you see, and it is, you're right. It's a lot of ping ponging. Like, this is good
Yes.
for you. No, it's not anymore. But yes,
Right.
it is. 2 years later, it's like,
Yeah.
no, it's confusing to the
It's
consumer.
really,
Yeah.
yeah. So I know. So I always say, like, look at that, but then get the professionals, go in and talk to them and then get evaluated. And then you'll know exactly what is good for you, what works for you, not just this majority population. Right. So, yeah.
100%. To kind of round out everything today, are there things that you think folks can do at home or common homework you might give to a client or things that we can do in a preventative nature to better our health or go in a more positive trajectory than maybe we already are today?
Yes. So I would say just the easiest one that everyone can do, it doesn't matter if they have pain or they have leakage or weakness, is our breathing. And I know it's like simple, but breathing, so diaphragmatic breathing. So using your diaphragm, your rib cage moving in a 360-degree, that what it does is it's sort of like a sub pump, or it's like a pump. It helps, get movement of the intestines, but also the pelvic floor works in synergy with the diaphragm. So when you breathe in and you expand that diaphragm, your pelvic floor relaxes and lengthens. As you exhale, and as you exhale, then you get that recoil of that pelvic floor. And so a little more of a gentle contraction. So you get a beautiful range of motion of your pelvic floor. You also get massaging of your intestines, so that better bowel movements, right? So we're thinking constipation issues, but also that pelvic floor gets to move really well. And that everyone should do that anyways for anything of health, right? Because that gets your parasympathetic nervous system, and we all are always up here and we clench everywhere, right? So this is a great way to get the whole body to relax. And it doesn't take much besides just a couple, every hour or so, do a couple nice deep breaths with your diaphragm, and you start to notice like, oh, I feel really good. And that gives beautiful pelvic floor range of motion. So you have a really healthy pelvic floor as you get older. So it's kind of an easy, nice one.
I love it. Not at all what I thought you were going to say. I don't know what you were going to say, but it wasn't breathing. And I like that because it is so simple. Everyone can do it. There's so many benefits to it.
Yes.
We should be doing more intentional breathing every day. Totally.
Yeah.
And I think that's incredible, and how much that can help someone. And it's something easily that we can do. So
yeah, exactly.
I love that. Super cool. This is why I love these interviews, because
Yeah,
I told you, everyone has a different perspective. Someone's going to say something that totally blows my mind, and breathing was one of them. Not at all what I would expect, but makes 100% sense. And so I love that you're able, these are the golden nuggets that we're going for. So I'm so appreciative of you being here. And to finish out today, I'd love if you could tell everyone how to reach out to you, how to get in touch if they have questions, or if they want more information, where they can find it.
Yeah, so our website is www.desertpt.com. So super easy. And then it has actually my email on there, Tara@desertpt.com. So any questions that people have, I'd love to answer, help out. And those are probably the easiest ways to get a hold of me or our office. So, yeah.
Well, thank you so much, Tara. This has been
you're welcome.
amazing. Yeah. You're fabulous. And I'm so happy that you were on today and debunked a ton of stuff for us. We really hope to have you on again. This was great.
Great. Thank you so much, Joe.
Thank you.